Which of the following is a potential complication of myocardial protection strategies during cardiopulmonary bypass? A. Increased coronary artery pressure. B. Arrhythmias upon reperfusion. C. Hyperkalemia during surgery. D. Increased systemic blood pressure. Answer: B. Arrhythmias upon reperfusion. Explanation: one of the potential complications after the use of myocardial protection strategies, such as cardioplegia, is the development of arrhythmias during reperfusion. When blood flow is restored to the myocardium after surgery, the sudden influx of oxygen and nutrients can cause electrical disturbances in the heart, leading to arrhythmias. Which of the following is most likely to be used in a delayed cardioplegia technique? A. A single, continuous infusion of cardioplegic solution. B. Intermittent infusions of cold cardioplegic solution. C. Warm blood cardioplegia at a continuous flow rate. D. Hypothermic cardioplegia followed by gradual rewarming. Answer: B. Intermittent infusions of cold cardioplegic solution. Explanation: in the delayed cardioplegia technique, intermittent infusions of cold cardioplegic solution are used to prolong myocardial protection. This approach allows the heart to remain in a state of arrest for a longer period while minimizing the risk of ischemic damage. Which of the following is the most common complication of using hypothermic cardioplegia during surgery? A. Hypothermic ventricular arrhythmias. B. Severe postoperative bleeding. C. Inflammatory response to cooling. D. Postoperative heart failure. Answer: A. Hypothermic ventricular arrhythmias. Explanation: one of the common complications of using hypothermic cardioplegia is the development of hypothermic ventricular arrhythmias. Cooling of the myocardium can lead to electrical instability, which may result in arrhythmias during reperfusion as the heart rewarms. What is the rationale behind the use of intermittent cardioplegia during heart surgery? A. To prevent excessive myocardial cooling. B. To avoid electrolyte imbalances. C. To reduce the duration of ischemia and enhance myocardial protection. D. To reduce the volume of the cardioplegic solution required. Answer: C. To reduce the duration of ischemia and enhance myocardial protection. Explanation: intermittent cardioplegia involves periodic infusions of cardioplegic solution to limit ischemia while providing repeated myocardial protection. This technique allows for short intervals of ischemic time, followed by brief periods of myocardial reperfusion, improving the chances of optimal myocardial recovery. Which of the following agents is commonly used to induce myocardial arrest in a cardioplegic solution? A. Sodium bicarbonate. B. Magnesium sulfate. C. Potassium chloride. D. Epinephrine. Answer: C. Potassium chloride. Explanation: potassium chloride is commonly used to induce myocardial arrest in a cardioplegic solution. It causes depolarization of myocardial cells, which leads to cessation of the electrical activity and contraction of the heart, allowing it to be protected during surgery. Which of the following is a critical determinant of the success of myocardial protection during cardiopulmonary bypass? A. Duration of the aortic cross-clamp time. B. Type of anesthesia used during surgery. C. Preoperative beta blocker use. D. Type of surgical incision made. Answer: A. Duration of the aortic cross-clamp time. Explanation: the duration of the aortic cross-clamp time is a critical determinant of the success of myocardial protection during cardiopulmonary bypass. The longer the heart is deprived of blood flow, the greater the risk of myocardial injury. Proper myocardial protection techniques, such as cardioplegia, aim to minimize this ischemic time and prevent damage to the heart. Which of the following best describes the effect of hyperkalemia on the myocardium during cardioplegia? A. It enhances myocardial contractility. B. It causes myocardial depolarization and arrest. C. It increases myocardial oxygen demand. D. It prevents arrhythmias post-surgery. Answer: B. It causes myocardial depolarization and arrest. Explanation: hyperkalemia causes myocardial depolarization, leading to cessation of electrical activity and contraction in the myocardium. This is the basis for its use in cardioplegia solutions to arrest the heart and protect it during surgery. Which of the following is the main advantage of using blood-based cardioplegia compared to crystalloid-based cardioplegia during cardiac surgery? A. Blood-based cardioplegia has a longer duration of action. B. Blood-based cardioplegia provides better oxygen delivery to the myocardium. C. Blood-based cardioplegia is less likely to cause arrhythmias. D. Blood-based cardioplegia is less expensive to prepare. Answer: B. Blood-based cardioplegia provides better oxygen delivery to the myocardium. Explanation: blood-based cardioplegia provides oxygen, nutrients, and other important factors that help maintain myocardial viability during ischemia. The presence of oxygen in the solution can enhance myocardial protection compared to crystalloid solutions, which lack these elements. Which of the following is the most likely consequence of prolonged use of cold cardioplegia? A. Increased risk of myocardial injury due to prolonged ischemia. B. Decreased likelihood of post-surgical arrhythmias. C. Improved myocardial function after surgery. D. Increased oxygen demand of the myocardium. Answer: A. Increased risk of myocardial injury due to prolonged ischemia. Explanation: while cold cardioplegia can reduce metabolic demand and protect the myocardium during surgery, prolonged use can lead to extended ischemia, which increases the risk of myocardial injury. A balance must be maintained between providing adequate myocardial protection and avoiding excessive ischemic time. Which of the following is a potential benefit of using intermittent warm cardioplegia compared to cold cardioplegia? A. It provides longer myocardial protection during surgery. B. It reduces the risk of reperfusion injury upon rewarming. C. It is less likely to cause arrhythmias during the cooling phase. D. It improves myocardial contractility post-surgery. Answer: B. It reduces the risk of reperfusion injury upon rewarming. Explanation: intermittent warm cardioplegia is beneficial in reducing the risk of reperfusion injury. It provides gradual myocardial cooling and rewarming, which can help the myocardium adapt better to the transition from ischemia to reperfusion, thereby reducing the likelihood of reperfusion injury.